I'd like to call the meeting to order, the Health and Human Services Board. It's 5 o'clock. Roll call, please.
Dr. Anwar, he did say he would be late. Julie Smith. Here. Lisa Lind.
Present.
Sean Anderson.
Present.
Kathy Leaf.
Present.
Dave Osnes is excused. Greg Telejohn.
Present.
Mike Barkalow. Deb Lindeman.
Present.
We have up for a quorum. Everybody received the minutes from June 21st. Is there any corrections or additions or concerns? If not, they'll stand approved as presented. Is there anybody here for public comment? Anybody here for public comment? They're not public. Okay. Business items, Health and Human Services monthly financials.
That seems really quick tonight. Okay, so the financials through June of... Thank you. The financials through June of 2023 are in your packet. If we go all the way to page 12, I just wanted to point out, so our final 2022 numbers, all the revenue that I'm aware of has been posted that goes back to 2022. We will likely have some audit adjustments once we get our final audited numbers, but otherwise that number is pretty close to really being final.
And it's black, which is a good thing.
And it's black, right, not red. Our purchase services, if we look, on page 15, behavioral health, that one took a big jump this month. Those will continue to trend high. As we're working on our 2024 budget, we're continuing to keep that in mind, and you'll probably see some higher budget numbers just because some of the changes that we've been making haven't had as much of an impact as we thought they might. From there, we're going to jump down to the healthcare campus. And so if we look on page 27, right now the healthcare campus is showing a positive $385,509. But if you look up in the June 23 year to date and you compare that to prior year June, what we don't have out here is the depreciation expense and the liability expense. So once those get posted, if they're similar to where they were last year, we will still be positive as a whole, but it'll be more around $80,000. So that's really all I had to point out. That's different than maybe last month. Any questions for me? Comments on anything?
The only thing I would comment on is looking back at the 2022, where we're in the black, especially by as much as we are. That's not, a lot of our peer counties are not experiencing that. They're finishing in the red multiple years in a row, where they have, usually it's purchase services, out-of-home placements, costs are going up, escalating really fast. So we're a little bit more controlled in St. Croix County with some of those escalating costs. And we've had a lot of vacancies, which end up saving us some money. So a lot of that has contributed to some of that, where the staff has had to double up duty and cover during those vacancies. But you can see the effect on the bottom line. I just wanted to point out really how fortunate we are that HHS, I know at least 2 of the last 3 years have finished in the black and not in the red.
Go ahead, Bob.
I was just going to comment too, as Faye mentioned, we had hoped to curtail some of these purchase service costs by early intervention efforts that we've made largely through ARPA funding. And I think we have made a significant difference by implementing those kinds of interventions. It's hard to measure, of course, what you prevent. But I think by having those co-responder positions and the case managers in the community, we prevented several, if not many, situations where people would have otherwise gone to hospitals or ended up in jail or some other event that would have, in the end, cost more. So I think they're having an impact. It's difficult to measure again, what you prevent as opposed to other means of measuring.
Any other questions? No? Okay, thank you.
You're welcome.
I didn't say that. I'll say it again. Presentation of the Health and Human Services Strategic Plan, or said it better.
Thank you, Mr. Chair. I've invited Dr. Carrie Weiss and Selena Freemark, who helped us develop our strategic plan, facilitated the sessions that we had, and did a lot of the, all of the surveying. And I've asked if Dr. Weiss would come up and sort of present to you the process that we went through in developing the plan, and I can focus a little bit on the specific goals that we came up with and action items.
Thank you. My name is Carrie Weiss. Selena, my colleague, is with me here but refused to come up to the mic, and so I will bear that. But I'll just kind of briefly sort of outline how it is that we came to this process, what the document is, and how to access it better for your information, and then also sort of, just go through a little bit of the ins and outs of it. So everyone has this, correct? And I'll just hit some high points here, but just to begin with a little bit of overview, I think Bob reached out to us, it was December of 22, and we actually really engaged in some conversation in January then. And what I would say is that we went pretty quickly. I thought that we moved really well through this, but in our initial conversations, what we did is Bob articulated the desire to have a shared vision for all of HHS that helped to name how they would support the county plan, how they were named in the county plan, and how they would address that. He also wanted to really bring forth a lot of innovation in this plan to help bring the entire division to a really forward-thinking sort of place. And so what we did is we hopefully tried to mirror that thinking. But we started out with a SWOT or SWOT analysis, so a survey that we sent out to stakeholders, and it was to really assess strengths, weaknesses, opportunities, and challenges that those folks would see. We then moved into sort of an analysis of that data, refined our process, but then what we moved toward is this March-April timeframe, where we started to engage in a workshop series. Selena and I are both trained in the HUE Life process of consensus workshop for strategic planning. And so we pitched this idea to Bob, who agreed that it would be a very consistent and concise way to travel through this. And so armed with that data from our survey, we sat down and engaged in this 4-part series workshop, -1, and I'll get to that in a moment. But the first workshop series is what you'll see here in your packet. And this workshop series was really about visioning. In order to do a strategic plan, you must name where you want to go in your end game. And so this first workshop was about a 2.5-hour series where we sat together and utilized, once again, this consensus workshop process. All voices were listened to, dialogue was engaged in, ideas were shared, and essentially what we did is we used that data from the survey to inform our thinking. First in your packet then, you'll see these bullet points. This is the data, which was extensive. It has been shared with Bob and his team of managers, spared of you all, but these are the bullet points, sort of the high points, the topics that people brought forth, and again, helped to sort of frame up our thinking as we engaged in this visioning workshop. As you go through, then these tables represent the entire compiled information from that first workshop series. The categories on top were the naming event, and so they represent a categorical thinking of all the different ideas in each of the columns below. What we did is we used that then to help size up and create a vision statement that we would be using for this exercise, and I believe that they will also be using. And the vision statement that the group came up with is St. Croix Health and Human Services strives to connect and respond to its community through outreach and education, while continuing to evolve and improve our service delivery model and support our staff. So armed with that, then we hit the second workshop. Knowing then where we wanted to go, the next workshop is really about naming those contradictions, the impediments, the things that will hold us up, those trip falls. This was a difficult one, but you can see then the workshop resulted in this table of information. Again, a categorical breakdown, but with each of the individual thoughts that were best represented. And this is the data that we collected. Knowing then the vision that they wanted to employ, the different contradictions that would hold them up, we went into our third workshop series, which was about creating the direction by which to get to your vision. So this was establishing our strategic directions. And in your packet as well, the bullet list names which of those barriers, such as conflicting culture of change, a particular direction would address. So in this case, pursue a culture of change and innovation. That is the direction that they'll take in order to fulfill that particular item. You could see once again the table with all of the data from the entire workshop series, which then left us to the fourth workshop series, but due to weather and scheduling conflicts, we did remote. And all that really meant was that I provided the team of managers a survey. They were able to submit goals to me remotely. That gave them an opportunity to do a little homework outside of the time, give a little thought, gain some feedback from their teams as well. They submitted those to me. They were very well done. I didn't have to do too much other than really sort of see the duplication that maybe took place, craft them into some SMART goals, and then just categorize them to where they maybe needed to be. What you see here then is the final version of that, which was agreed upon between our planning team, Celine and myself, and then of course Bob. Each strategic direction, and then the subsequent goals that were written up by Bob and his team, and then just crafted more fully by us. This is the entire strategic plan. By the entire process, I don't know if there's questions or if you wanted me to go through each of the, yes. Okay. Now where to go? Strategic direction, directive, number 1, was named as pursue a culture of change and innovation. The goals by which to meet and achieve that direction would include, by 2026, St. Croix HHS will build a department-specific intranet site using MS 360 and Teams for information sharing, collaboration, and gathering timely feedback. Continuing, they will establish an HHS communications team with representatives from various HHS divisions to collect, consolidate, and disseminate information relevant to the department. And then finally, we'll explore options to communicate effectively and timely with all stakeholders for insight on areas of change and innovation as it pertains to the department. There were some very strong themes that really came up here, which was use what we have, access it, and better sort of deploy it, but also share that and communicate it. And so they grew this team of people who will sort of spearhead that initiative. Questions, though, or comment as needed, please stop me.
How are you going to measure these improvements?
I'm going to leave that.
So we'll have to, as managers, we'll have to get together and find and decide upon metrics that would make sense for these particular goals and come up with those objectives. So we haven't fleshed out all of that yet.
Okay.
But ideally, the overall intention, of course, is to improve communication as a department with all the different divisions having some input there.
The second directive, analyze workflow to improve service delivery. Again, they had a lot of conversation about how to just become more efficient and once again, carry that throughout the entire division. The goals here, by 2026, St. Croix County HHS will develop and implement a divisional collaboration group that includes representatives from each HHS division to discuss workflow, target demographic, and referral processes within each division, and that meets at least monthly. Continuing, we'll explore a system with processes that improves operational efficiencies. And then finally, we'll analyze its organizational structure to better assess its efficiencies and workflow operations. Again, here, the big idea was to just work smarter, not harder. The third directive, align budget priorities with their vision. By 2026, St. Croix County HHS leadership will conduct an ongoing exercise that analyzes our service areas to monitor vision alignment, productivity, service costs, revenues, and staffing needs. Continuing, we'll establish a quality assurance process within each division to ensure all billing opportunities are efficiently captured and supported with quarterly fiscal management. A lot of strong themes about making sure that what they're doing is, of course, aligned with that vision and that their activities and funding moves with that. There's only two more. The fourth, explore and expand legislative advocacy. By 2026, St. Croix County HHS will develop a legislative advocacy committee that is committed to messaging our priorities, attend advocacy efforts locally and at the Capitol, and work in conjunction with the Communication Committee on messaging HHS legislative priorities for the next legislative cycle. Continuing, this legislative advocacy committee will create a quarterly internal learning series on advocacy and how to influence legislative policy that impacts our department. This was, I think, speaking to a lot of that innovation and then carrying forth that message to really educate and communicate the efforts. Did you want to speak?
I was just going to, speaking to advocacy, I'll let you finish, and then I'll.
And then the final direction, enhance technology proficiency. HHS will intentionally focus on steps to incrementally improve our use of technology as a tool for internal and external communication, building efficiencies into our work and to market our services through social media and our website. HHS leadership will establish a framework where technology needs are most critical and move forward with an implementation plan. Continuing, they will identify, train, and appoint super users who will impact internal use by providing bi-weekly recorded IT infomercials or lunch and learns on how to utilize tools that can make our daily work more efficient. And then finally, they will create workshops in coordination with the Information Technology Department to help staff become more proficient in software applications.
Thank you, Carrie. Thank you, Selena, as well. So as you'll see at the bottom, there's a link to the county strategic plan. If you look at that county strategic plan, goals 1, let me look, community well-being under the county strategic plan, and the 2 goals under that, as well as service delivery and the 3 goals under that area, all apply to HHS in some way. And we tried to use those as a framework to allow Carrie and Selena to guide this process so that we were following the county strategic plan, just drilling down into how we accomplish some of these things. As far as the details, Chair Telejohn, as you mentioned earlier, you have to have measures and metrics and ways of monitoring progress in all of these areas. So we understand that. And given the limited time that we had to develop the plan, we wanted to get the framework in place. And then in our manager meetings, which are held every other week, we'll start to develop those kinds of measures. And I'll keep you all informed of how we're doing and what we're doing and how we're measuring it as we go. So I know there's a lot of detail that still needs to go into the plan, but this gives us, I think, as Dr. Weiss said, it gives us a direction to head and some parameters as to where we want to focus our efforts going forward. A lot of this will involve work with other departments, community partners, and coordination with all of those in order to accomplish some of these tasks. We don't want to go rogue and go off on our own and do stuff without keeping Adam or Ken or anyone else informed about what we're doing. So the idea here is really to clarify our vision and where we want to be, understanding that human service work is always dynamic. It's ever changing. You have to be adaptable and flexible in your thinking. I think you need to encourage innovation. You need to empower people to think of solutions to long-held problems that a lot of times people will throw their hands up and say it's just easier to do it the way we've been doing it. The consolidation of services or the realignment of services, that makes sense. We're going to look at that very closely and how we can do things as a department where we cross divisional boundaries if we're serving a similar population or have a similar goal in mind for that population. Of course, there are things that get in your way. Funding streams are often tailored for a particular program, and they're not as flexible as we would like them to be. So again, that's where advocacy comes into play at the legislature and with any policymakers, the board included, of course, and looking at how do we encourage policy development that brings us into a forward-thinking approach. When we go to the legislature, or when I go to the legislature and talk to senators or Congress people, I don't go there and say we need more money for this because it's a big problem and we just need more money to respond to the problem. I go there with at least an idea for a solution that would help to curb those costs, that would maybe approach the problem from a different angle, and at least give them something to think about. It doesn't always work. I mean, sometimes their minds are made up, et cetera. But you can build these relationships with your legislators and with your boards where you can at least introduce a different way of thinking about a problem that often then leads other people to come up with solutions that help. And I think advocacy is a relatively underutilized skill that we can, or tool that we can use to influence policy, locally and at the legislature. And I want our staff to understand how policy influences the way we do business. And if we want to do business differently, then we have to have some impact on that policy. We had a disappointing year at the legislature, or at the state, in terms of the way the budget came out, a state budget. We were hoping for some additional support in various areas where we're struggling, primarily around the early intervention and crisis-related service areas. Although we didn't get a lot of additional funding, we got some additional funding that'll go to the ADRC and some to adult protective services, but it's really nominal. But we were able to talk with lawmakers and introduce ideas that did resonate with them, and who knows, as time goes on, start to build this momentum around early intervention, upstream kinds of thinking, rather than throwing money at the deep end costs over and over again, only as those problems continue to get worse. So that's why we're seeing our purchase services go up in spite of these efforts, statewide, not just here. But the reaction to crisis events is more costly than trying to prevent them. And that's the angle that we're taking. And this plan, I hope, gives you some idea of where we'd like to be and where we're trying to go. Hopefully, you as a board support us in that effort, and if you don't, you can let us know, and we'll go back to the drawing board. But any questions or anything?
Anybody? Go ahead, Deb.
I would just make a comment. I mean, I think it looks good, and it's real concise and everything. I would like a report on it. I mean, what I always see happen with the strategic plans is we develop this big plan, and then no one even knows in a year, okay, did we have a strategic plan, and what was that again? So it'd be nice as a board to kind of get an update maybe in a year's time or something like that.
That's a good point, Deb. And I think what, obviously this plan should guide everything that we do in some way. And so it just makes sense to refer back to this plan when we're talking about initiatives or progress or lack of progress, and say, here's what we did in relation to this plan, here's where it went right, here's where it went wrong, et cetera. And we'll also, like I said, we'll share the metrics that we're using, or the measures that we're trying to keep track of, so that we can show you the progress and data and not just our opinion. Yeah. And get community feedback along the way. I think Dr. Weiss would agree that you want to check in from time to time with the public and with the board and everybody else to see how we're doing, to get that reflection back.
Is there going to be any more interaction with the extension then on this, or are they done, or?
I sure hope there's more interaction.
Oh, okay.
I mean, they've been just wonderful in terms of helping us. There was no cost involved. They came to our manager meeting, so we didn't have to schedule a time outside of work. We used our manager meeting time to do this. And, you know, I can't say enough about Dr. Weiss and Selena. Just their willingness and their engagement in this process was immediate and thorough. And, you know, we couldn't have done this work without them, I don't think. We would have had to hire somebody outside of HHS to do it. And I think it's really important to have a strategic plan that's useful, that's meaningful, and that guides the work that we do. And I will, as long as they let me, I'll check in with them and get advice along the way. You know?
Oh, good.
Yeah.
Thank you. Any other questions? No. Next item is healthy and affordable housing policy recommendations.
Thank you, Mr. Chair. I know that housing, affordable housing, housing in general has been a topic of interest and frustration in our county for a while now, and it's come up a number of times in our HHS board meetings. What can we do about it? How do we help the unsheltered? How do we help people that are in emergency housing situations, et cetera? And also along the lines of workforce housing, how do we develop housing that's affordable to those folks with the lower end of the salary range who are vital to the kind of work that we do? About a year ago, I'll read from my notes here so I don't stray. About a year ago, after this interest was expressed, or while this interest was being expressed by the HHS board and others on the board of supervisors, about the same time, United Way of St. Croix Valley received a grant to undertake a similar kind of policy scan and analysis of the housing situation in St. Croix and Pierce counties. So I had mentioned, you might remember in the past, that they were undertaking this effort and that I would report back when we had a product to show you, their product. But that final report from the United Way of St. Croix Valley came out just about a month ago, I think. It might have been just after the last board meeting. And that's included in your packet. I wanted you to see the whole thing. It's rather lengthy. But I also just took some notes to try and summarize what the report said. And I'll just, let me just do that, and then I'll see what questions you have. But the idea here is to look at the housing situation in a variety of contexts to see what can be done, what policies are already in place in other areas of the state and of the nation, and then what maybe HHS can do for our part in finding solutions to the housing issues. So the grant was secured through a DHS grant called Mobilizing Communities for a Just Response. United Way of St. Croix Valley got the grant, and it was a one-year grant to support housing assessment and policy scan, do a housing assessment and policy scan in St. Croix and Pierce counties to address housing needs through policy and advocacy. The Healthier Together, which is a coalition of organizations and leaders in St. Croix and Pierce County with a vision of creating and maintaining healthy communities, partnered with Build Healthy Places Network, and that's a national center for fostering cross-sector collaboration across healthcare, public health, community development, and finance. They work together to develop or facilitate a stakeholder engagement and conduct research and policy analysis around the housing situation. Chair Telejohn and I are on a steering committee that was formed as a result of this. I don't know, Chair, if anyone else here was on that. I don't think so. Okay. So we were on the steering committee that took part in these sessions throughout the year. This report that you have in your packets provides policy recommendations that address 4 priority areas identified by stakeholders during steering committee meetings. And those 4 primary or priority areas are senior housing, workforce housing, wraparound services, and community engagement. This report is intended to support the efforts of Healthier Together to advance local policy change in St. Croix and Pierce counties, and it includes a set of local affordable housing policies that were successfully adopted in other jurisdictions, and the report is a guide intended to leverage each stakeholder's power and unique assets with their sector's influence and opportunities to work together on local policy design. So when I looked through it, I read through the whole thing and tried to think how could HHS support certain aspects of these policy recommendations, or how could we contribute in particular to some of the housing needs. And the things that stood out to me is that, first of all, health, or I should say health and affordable housing is an essential overall health and stability, and is important to overall health, economic stability, and social development. So health and housing are really inseparable. If you don't have safe housing as a community, you're not going to have good health in your community. The two things are not separate in some way. So safe housing is essential to health and well-being, and wraparound and support services are the area that I think HHS could be most effective in contributing to this effort, like around like some of the things that we're already doing with ARPA positions and other areas of HHS and children's services and behavioral health, which is working with people in their homes with respect to the ARPA positions, using case managers to go into the community, to go into recovery housing, to go into emergency housing, environments, and work with people in those environments before they petition for care at our facility. So it's really trying to reach members of the community that are either homeless or at risk of being homeless, and trying to assist them prior to them falling off that cliff. And a lot of that risk involves mental health and addiction, economic instability, some of it resulting from the pandemic, and inflation, and just being priced out of communities. So people are on the precipice a lot of times of being homeless, and I think we can reach a lot of those folks in environments where we could be helpful. We do have a need for housing for women, single parents with kids, families, at least temporary housing. I know Onyx House provides a lot of recovery housing opportunities for various populations that helps with that transition if somebody's in recovery or coming out of jail and needs a place to stay until they stabilize. That kind of effort to me has great value and a good return on investment with respect to bringing people back to the community in ways that are where they're productive economically, where they're productive socially, et cetera. So the challenge for us, of course, will be to, going back to advocacy, will be to help change policy and regulations around funding streams that allows us to do things like this without, with the idea of bringing in some revenue to support it. Because even if we want to do this stuff, we have to have the ability to pay for it and support it. So not getting ahead of myself, though, I think we want to stay focused on what we could do and then try and find ways to do it. We were able to with ARPA funding. It's a one-time limited term funding stream, but it at least gave us some data, and so it will give us some time to reflect on how effective those efforts were, and then show that to you all and to the state and say these efforts were effective. Or not, depending on how the data shows. So our intention is to continue to work with Healthier Together in developing a work group that uses this policy scan to develop actionable next steps. We want to keep the momentum going from this, and I know these kinds of reports are sometimes viewed as, well, that's nice, but what do we do about it? But first we have to know the extent of the problems, the details behind the problems, and then develop steps to address them. And I'm not as patient as I used to be, so I'm trying to keep this moving forward from our end, and hopefully with our partners in the community, we can make a meaningful difference in the housing situation. We need to for our workforce and the people that don't have homes. So, any questions that you have about any of this?
Any questions? And it's not necessarily homeless, it's the unhoused that's a big issue also. And workforce housing and employers around here, where they can't get employees if they don't have any place to live and affordable.
And Chair, you provided a link to the NACO article,
Right,
the National
if everybody read the
Association
NACO,
of Counties. Yeah. Did you want to speak?
Newspaper, Wisconsin County Invest in Housing for the Next Generation, that's referring to Washington County. And I don't know if anybody on the board read the article, but Josh Schoeman, the executive director, was featured in there. And they're coming up with proposing a solution for workforce housing. And essentially, people are paying rent of up to $2,000 a month rent and not having enough money to save for a down payment. And they're saying that their average, based on the employers there, the pay and so forth, that the average workforce housing probably starts at around $320,000 for Washington County. It's probably different here, and they're putting up a $20,000, I'm paraphrasing this correctly, $20,000 down payment for the workforce housing, with it being paid back through community service of $25 an hour, or you can prepay it yourself or whatever, but it's essentially a second mortgage that's payable over time for the down payment. And that's to help come up with the down payment for a house. But they put together all the players and townships and municipalities to come up with this solution. It wasn't just the county, but it was just, the municipalities too, and the average cost figure out what the average cost of housing is and so forth. It's a good article. If you need copies of it, I can send you it. But
I brought a copy of it, so there's a link, of course, you can follow. But if you'd like to see it, I have a copy.
Is there, Deb, you have a question?
No, I said I'd like a copy of that.
Oh, okay.
Did you send this?
What's it? I can email it.
Okay, please.
Okay, email. If I don't forget to read my note. Any other questions? Go ahead.
The interesting thing, Mr. Chair, about what Josh Schoeman is doing in Washington County, or what his intention behind this was like you said, it would allow people to have a down payment for their home through that second mortgage. But then it would also require people to be engaged in the community, right, to do community service work to pay off that down payment. So it does two things. It gives people a home, and it more or less forces them to be engaged in the community and doing things that benefit the community. So it's an interesting idea. See if it works.
Yeah. I'm not ignoring you, Kathy. I hope you're speaking up.
Have I ever been known to not speak up? No, I think it's a fabulous idea that they're doing, the community service aspect. I mean, I think it'd be interesting to see what outcomes they have from that and what they can measure. But I feel like it's definitely an issue in the St. Croix Valley region, affordable housing, and it's affecting everything from school enrollment to workforce development. So it's a critical need.
Yeah. So, any other questions, comments on housing, workforce? Okay. That's it for the business items. Any requests for future agenda items? Anybody? Otherwise, we'll keep winging it. Announcements and correspondence. Any announcements or correspondence? Go ahead, Bob.
I just wanted to keep the board informed of a independent living supports pilot that our ADRC, a grant that our ADRC got. What this grant does is it provides short-term, flexible, and limited services for people at risk of entering Medicaid long-term care in select areas of Wisconsin. The grant would help 233 enrollment slots at $7,200 each. So each of the participants would get up to that amount to help prevent them from, to help stay in their home and prevent them from entering long-term care. And then it supports a limited term position that would help to coordinate that. That's a really brief update on that, but I wanted just to keep it on your radar. And then I just wanted to mention the other thing was Recovering Together cafes are taking place at the New Richmond Services Center and other locations in St. Croix and Pierce counties. These are going well. The attendance has been fairly good. We have capacity for about 12 individuals plus their kids, and we have been seeing between about 4 and 8 people showing up for each of these with their kids. We're able to work with Family Resource Center on this project. It's part of our ARPA-funded community projects. And the idea here is to have an informal service for parents who may be struggling with recovery of some kind, who can come to this curriculum that's taught by trained facilitators from both St. Croix County and Family Resource Center. It's informal, but there's a evidence-based curriculum that they follow. And they're provided a meal. The kids have daycare provided, the parents have daycare provided next door to the room that we do it in. And it seems to be, based on the comments that we're seeing, it seems to be very well received by the public. Just a quick snapshot of what people are saying about it. It's fantastic, inclusive, healing, enlightening, encouraging, hopeful, positive, eye-opening. So those kinds of statements are what you want to see, I guess. But the idea here is, again, to try and prevent families from falling into a situation where they might need formal involvement with our department in children's services or behavioral health. Of course, provide that if they need it, but to intervene at an earlier stage of need. That's all I had.
Thank you. If that's all announcements, correspondence, I'll adjourn the meeting. Thank you, everybody.